Hi guys, welcome back. Today we're going to talk about antibiotic resistance and how the COVID-19 pandemic is affecting antibiotic resistance. So let's talk about how antibiotics were discovered. Back in the 1920s, this guy, Andrew Fleming, discovered penicillin in his lab in London. Almost immediately after discovering penicillin, he warned his fellow scientists that bacteria had the ability to change themselves to be resistant to these antibiotics. And that warning kind of went unheeded. Soon after World War II kicked off and penicillin was used very rapidly and extensively to treat wounds on the battlefield. And it was extremely successful, and that is so fantastic. But that is exactly how antibiotics took over the world. And those warnings of antibiotic resistance were kind of swept away, and we continued to move antibiotics into civilian practice and use them widespread to treat everything from coughs to earaches. Basically, through the 90s, antibiotics were kind of used unchecked. And so we created this huge problem that is antibiotic resistance. Now let's talk real quick about what antibiotic resistance is. Basically, when you treat a bacteria with a specific antibiotic for a long time, bacteria are very smart and they're able to change themselves in many different ways. Here's a little graph that I found that shows you different ways that bacteria change themselves in order to become resistant to antibiotics. They can change the structure of their cell wall to make sure antibiotics can't get in. They can pump antibiotics out of the cell in order to remain dominant in the cell. They can modify where antibiotics would attach to the bacteria so that the antibiotics can't attach to them any longer. These are all things that bacteria do in order to resist antibiotics. And it's pretty scary, but it's also pretty interesting. So that brings us to now. Yesterday, there was the results of a study conducted through 2019, and this was published in the Lancet, and that link is below in the bio. And that study shows that antibiotic-resistant infections have actually become a leading cause of death globally. And the places it's affecting most are sub-Saharan Africa and South Asia. And so basically what this study shows is that 1.2 million people died in 2019 of antibiotic-resistant infections. And that means that it's a higher cause of death than malaria and a higher cause of death than AIDS worldwide, which is a really huge deal. So let's now talk about how COVID-19 is affecting the issue that is antibiotic resistance. So this is happening in a few different ways, but what we're seeing is that there's this reemergence of an increased use of antibiotics in healthcare. This is caused by several factors. One of them I can personally attest to, and that is that COVID-19 tests they're great, but some of them aren't that accurate, and there's a lot of user error going on. I can say that I just recovered from COVID myself, and I took 2 home tests, and they were both negative, even though my entire family was testing positive. And then I went to a testing facility and got a PCR test done right next to my son, and mine came back negative and his came back positive. I had to return again to get another test and do it myself for them to get enough of a specimen for me to test positive. But if I was not educated in public health, I may not have returned to get my positive test after the 3rd try. And I could have been assumed that I had a bacterial infection. And so issues such as this is causing some COVID cases that are being inaccurately diagnosed to be treated as bacterial infections. And so doctors out there trying to do the most good for their patients are treating what looks like a negative COVID test with antibiotics, therefore increasing antibiotic usage. Another thing that we're seeing is that, the fear of secondary infections while having COVID in the hospital is pretty terrifying. When you have COVID, your immune system is decreased. And therefore, if you acquire a secondary infection, your body's not going to be able to fight it off as well. So the numbers from the study that I read are showing that between 70 to 97% of patients hospitalized with COVID are being treated also with antibiotics. And in reality, only 10% of people who are hospitalized with COVID actually acquire a secondary infection. So we are giving out a lot of antibiotics for fear of secondary infections that aren't actually happening. But what do? Doctors are trying to save lives here. So it is a very difficult line to walk. And I really feel for these providers on the front line of COVID right now. So the second issue that's causing increased antibiotic resistance with COVID is misguided antibiotic use. Back in the beginning of the pandemic, we didn't have approved medicine to treat COVID. These poor providers were out there trying to treat people and not knowing what was going to be effective and what wasn't. And so because it's an upper respiratory or a respiratory overall type of infection, the go-to in the medical community was always azithromycin. And they knew that it wasn't a bacterial infection. However, azithromycin's mechanism of action also has anti-inflammatory properties, and there are some benefits to it outside of treating a bacterial infection. And so it was used very widely. And now what we're seeing is widespread resistance to azithromycin. And now it's to the point where providers aren't even prescribing it anymore for actual upper respiratory infections because there's so much resistance to it. So one of the final ways that we're seeing antibiotic resistance increase is that due to the pandemic, there's a lot of telehealth appointments going on all across the world. And telehealth is extremely difficult for providers to really treat and understand what's happening with a patient. And when they see a patient who has all of these symptoms and they're at a telehealth appointment and they're saying, hey, I've tested negative on home tests for COVID, or whatever the case may be, I can't get my hands on a COVID test, which is the case for so many people throughout the world right now. Doctors, want to do the most good. And so antibiotics are being prescribed in a higher amount right now because so many people are sick and don't have access to tests, or tests aren't being accurate. So that is causing a rise in the prescribing of antibiotics. Finally, globally, there is a huge issue that's not really being talked about all that much, and that is that there are changes to availability of antibiotics due to COVID. There are a lot of countries out there who finally took antibiotics off of the shelf for over-the-counter purchase. But when COVID really took off and healthcare systems were overrun, a lot of these countries did put antibiotics back on the shelf for over-the-counter purchase. And so all these people getting sick, perhaps with COVID, perhaps with other things, now had the ability to just walk into a store and buy antibiotics. And that is extremely dangerous and has definitely led to an increase of antibiotic usage and is definitely going to contribute to this issue of antibiotic resistance. So what now, right? We have this huge problem. Well, there is some good news regarding COVID and its effect on antibiotic resistance. It's not all just bad news. We have learned some things from the COVID pandemic that is going to and is currently positively affecting the issue of antibiotic resistance. Now, one of those is that, as global health communications practitioners, we have been pushing really hard hygiene, washing hands, being clean, wearing masks. If you're sick, stay out of public, don't cough on people. All of those things that we're teaching for COVID is actually also slowing the spread of bacterial infections. And so that which we teach for COVID is going to benefit us in other ways. And one of those ways is less bacterial infections, hopefully, although I don't have like a study to cite for saying that. But we know that that will be an effect that will come out of this COVID pandemic. A second way that the COVID-19 pandemic is helping us address the antibiotic resistance issue is that we're learning about infection containment in hospitals and in healthcare. We've put a lot of effort into ensuring that COVID doesn't spread within hospitals, which is a huge issue for bacterial infections in hospitals. We're talking about MRSA, which is one of the top bacterial infections that causes infection-related deaths. And so learning from the COVID pandemic better ways to isolate infections is going to assist us in not spreading also bacterial infections while in a hospital setting. Also, finally, COVID is increasing our thought process and our ability to understand the One Health approach to global health. And that is that everything on this planet feeds into health in its own way. And we have to take into consideration the entire environment, whether it's animals, humans, air, water, soil, plants. Everything has to be taken into account when we're trying to address global health issues. And so the emergence of the One Health approach during the COVID-19 pandemic is going to help us have a One Health approach when it comes to antibiotic resistance. Additionally, outside of COVID-19 and how that's helping us learn better ways to address the antibiotic resistance issue, there are a couple of things that are happening in science that are really exciting and really interesting. And I'm just going to touch on them real quick. Links to some of these articles are in the bio, but I don't want to go into them too much. But one thing that's really interesting, a whole field of study for antibiotic resistance is genetics. And there is this thing called CRISPR. I'll let you read about it yourself. That is looking into how to alter genes in order to combat antibiotic resistance. And what's interesting is it's the genes in bacteria that enable the bacteria to develop this resistance. Obviously, everything in any type of living organism that manifests in that organism is a manifestation of what its genes are doing. And so in order to combat a genetic issue in the bacteria, we have to look into genetics. And so CRISPR is a technology that they're using to look into that. Another one that the scientific community is working on right now is basically bacteria. Studies have shown now that bacteria, the way that they're able to shuffle their genes around to develop this antibiotic resistance is through the use of a very specific enzyme. And so there's a whole field of study right now going into attacking this enzyme. And what this enzyme does for bacteria is that it keeps the bacteria's energy up as it's building resistance. So there was, some interesting studies done that showed that bacteria, in order to develop antibiotic resistance, they actually lost a lot of energy. And so we were able to sort of capitalize on that for a while by prescribing a multi-phased approach to antibiotics by either, changing the antibiotic midstream while the bacteria had lower energy, or by drastically increasing the same antibiotic early on in treatment in order to attack this loss of energy that bacteria had in order to develop the resistance. Well, now we found out that in order to keep its energy up to get around this practice that we had introduced, they're using a specific enzyme. So there's a whole field of study into attacking that enzyme in order to diminish the energy of the bacteria to develop antibiotic resistance. So there's a lot going on. It is scary. There's a lot of studies that say, in 2050, we could be looking at a post-antibiotic era where bacteria are resistant to most of our widely used and widely known antibiotics. And so, COVID-19 is going to have both a negative and a positive effect on this issue. But just know that there is an entire scientific community out there that is looking into a lot of different ways of approaching this issue of antibiotic resistance. And next time you get sick, don't rely on antibiotics so much. There are some infections that are in fact infections, but your body has the ability to fight it off. Buy food that doesn't use antibiotics in the feed for animals. There are a lot of different things that we can be doing personally to address this issue, while scientists are also addressing this issue. So read some of the links below in the bio and learn about some of the things that I talked about that are super interesting. And then just also, as always, look into what you can do personally to help the cause that is this rising issue of antibiotic resistance throughout the world. All right, guys, thanks for joining me. Please like and subscribe to my channel, and I hope you have a happy and healthy day. See you soon.